today. The website is www.bodybyravi, R-A-V-I, bodybyravi.com.
Good morning, ladies and gentlemen. I am Dr. Nik Nikam, your host. You're listening to All India Radio Houston on 1050 KCH in Houston, Texas. We'll be here from 10 to 11 a.m. and I am going to be speaking to the Jain Center on February 22nd at 10:30 a.m., which is located on 3407 Ork Street. And I'm going to be talking about women and heart disease. And of course, our second topic today is going to be women and heart disease. And February is recognized by the American Heart Association as a Women and Heart Disease Month. And now I'm talking to Dr. Ravi Somayazula, and we are talking about plastic surgery. So this entire hour has been dedicated to the health and well-being of women. And if you'd like to join in the conversation, the number to call here is 281-745-4161, and we'll be here till 11 a.m. And this program is also being videotaped, which is going to be on YouTube and Vimeo under my blog, Nik Nikam, Nikam. And if you'd like to be a guest on our radio program on any topic that you like to discuss in your expertise, please give us a call. Our number is 281-745-4161. And let's proceed. Ravi, let's talk about tummy tucking.
Yeah, so that's one of the top three procedures, as we mentioned, that plastic surgeons perform generally. The tummy tucks are, we see it, mostly in women who've had children.
Yeah.
And it's a way of contouring the abdomen after you've had children. So typically, I'll have a woman that comes into my office. Yeah. Maybe she's had 1, 2, 3, 4 children.
Yeah.
And she's planning on not having any children. Now, it's not something that, if you're planning on having children, it doesn't mean you can't have a tummy tuck, but just know that if you're going to do that and you're possibly thinking about having children, have a pregnancy again can cause stretching out of the skin and everything.
Yeah.
And so it's probably the best thing to do is to wait until you're done having children. But basically, it's a way of contouring the belly in which you tighten up the skin.
Yeah.
You do liposuction to the areas on the flanks to give you that hourglass shape, and liposuction above your navel to try to make that upper area flatter. And I do that typically in conjunction with the removal of the skin to make everything tight. Yeah. And also what we do is we bring the muscles of the abdominal wall together. So you're basically tightening it in two planes, both the horizontal and the vertical plane, and that gives you a very, very nice shape to your belly. And so that's a procedure which again is a day procedure. The operation, depending upon how much liposuction needs to be done, can range from 2.5 to 4 hours to do.
I see. Okay, I have several questions. Number one, let's talk about liposuction, then we come to the skin and other things. How do you do the liposuction, and how much fat do you remove?
Yeah, so the liposuction is done by you inject fluid into the fat, and what that does is a couple things. That fluid has similar to it has an anesthetic, so very similar to Novocaine. Yeah. So whatever you'd go to the dentist for, they numb you up. And what that does is it creates a situation where after surgery you have very little pain. Liposuction alone is painless.
Is that it?
There is no pain. That's one of the things that I can tell patients. If you're just doing pure liposuction, it does not hurt.
Yeah.
So that's because A, it's a painless procedure, and B, for the first few days afterwards, for at least for the first 8 to 12 hours afterwards, you'll have the effect of the Novocaine in there.
Yeah.
And then also it has epinephrine, which is another medication we place in it to try to decrease bleeding. So it has all the good stuff to make it a safe procedure and a painless procedure. And then to your second question, how much fat do you remove? A lot of it, I like to think of liposuction as not how much fat you remove, but how much you leave behind.
I see.
So if you are very, very aggressive and remove a lot of fat, you can get into problems with contour abnormalities. Yeah. So it's a judgment call. So you do liposuction basically until you think the end point has been reached, and a lot of it is based on feeling and visual inspection.
Yeah.
So at that point, once you do a liposuction basically until you've reached your end point based on what it looks like and how it feels.
So when you remove fat from like a flank on the side, do you remove as much as you want, or do you leave a little bit? Because when the body remodels, then some of it may shrink, and if it's going to leave dimples.
Right. So with
I'm not a plastic surgeon, but I'm just curious.
No. With liposuction, you do get a little bit of skin tightening.
Yeah.
So there's that, and the more aggressive you are with liposuction, the fat has different layers underneath the skin. There's a superficial and a deep component. If you remove all of everything, the superficial and the deep, then all you're left with is skin, and you're at a higher risk for getting dimples and that kind of thing.
Oh.
So that's what I mean by it's not how much you remove,
I see. That
but
makes
it's how
a lot
much
of sense. Yeah.
how much you leave behind. So you got to be careful. Having said that, if you don't take out enough, then you don't see much of a difference. So it's really an artistic thing. I mean, there's some science to it, but a lot of it is just kind of looking at it with a trained eye.
Well, the next question is, you said you tightened the skin. Are we going to see multiple scars, or are they going to be like along the planes where there are scars? Are the folds already in the body?
Yeah, so in order to do liposuction, we have to make a lot. If you do liposuction with a tummy tuck, there are no additional scars because the same incision that I have to make to do the liposuction is the same incision I do for my tummy tuck. So there's no additional scars.
Yeah.
If we just do liposuction, these scars are maybe a millimeter to 2 millimeters long.
Little punch holes.
Little punch holes in order to introduce the cannula. And we place those little punch holes in areas that you can't really see. So underneath your underwear line.
I see. Yeah.
And if you hide it correctly, you don't even see these little punch holes at all.
See, I got skinny arms and legs, and I got a little tummy, just like most of the middle-aged men. Am I a candidate for liposuction? In other words, are men also some of your patients?
Yeah, I get occasional men that come in for body contouring procedures. It's mostly women. I would say 80 to 90% of it is women.
Yeah.
I think that men, it's not that we can't do it. It's just something that we don't see a lot of because I think men are a little bit more self-conscious about that, and they associate these procedures with something that women do. So I like to think about it as, if you're getting, it's about how men view manicure and pedicures, right?
Yeah.
Manicure and pedicures are something that most women go for.
Yeah.
And I think men feel that this is a plastic surgical procedure. This is women get plastic surgery. I'm not a woman. This is kind of a feminine thing.
Yeah.
But at the end of the day, we're all human beings, and women can benefit from plastic surgery, and so can men.
Well, that's fascinating. Okay, so since this is mostly a cosmetic surgery, I guess this is not covered by insurance. Am I correct or not correct?
Well, there's a little bit more of a gray zone with this compared with breast augmentation. Typically, it depends upon how flat your belly is to begin with. If you're otherwise healthy, you're 25, 30 years old, 35 years old, you've had 3 or 4 children, and you just have a little bit of loose skin, and that type of patient, for the most part, may not be covered by insurance. If there's a question, the best thing to do is just come into the plastic surgeon to be evaluated. But the short answer to a potentially long answer is that sometimes insurance can cover it partially.
I see.
So if there's any questions about it, and any of our listeners have any questions about, hey, does insurance cover my tummy tuck? The best thing to do is just come in and talk to me or talk to your plastic surgeon about whether that's possible or not. But in some instances, to answer your question, yes, it can be covered by your insurance.
Okay. Let's give out your contact information, and we'll take a little break. And when we come back, we'll wrap up with earlobe repairs.
So Dr. Ravi Somayazula, Body by Ravi. The address is 3531 Town Center Boulevard South. It's Suite 102 in Sugar Land, Texas. The office number is 281-242-1061. And again, in about a month or so, we'll have a website that has before and after pictures, galleries, and more information about everything that we talked about today. So that website is www.bodybyravi.com.
Ladies and gentlemen, you are listening to All India Radio Houston. I am Dr. Nik Nikam, and this is 1050 KCHN AM in Houston, Texas. We'll be here till 11 AM, and we are talking about beautification of women, breast augmentation, reduction, tummy tucking, and other plastic surgical procedures. My special guest is Dr. Ravi Somayazula. He has his office here in Sugar Land, Texas. And after this, we're going to be talking about women and heart disease. This whole hour has been dedicated to women's health and well-being. And I will be talking to the Jain Center on women and heart disease on February 22nd at 10:30 p.m. The address is 3407 Ork Street. You can contact Ashok Singhvi, and his number is 713-789-2338. And let's get back. Let's before we conclude, let's a lot of Indian women get their ears pierced, and as they start putting bigger and bigger jhumkis, the next thing you know, they start getting big holes. Is there something we can do?
Yeah. So the condition that is called a torn earlobe.
Yeah.
So there's different spectrums. You can either have a completely torn earlobe, or you can have a stretched out earlobe with a large hole. And so there's definitely the surgery can definitely correct that as well. And typically that's a procedure that we can do in the office as well. So and the insurance company can sometimes approve that as well. So every insurance company is a little bit different. Usually if there's a history of trauma, I've had some women really literally have had people steal their earrings out of their ears by ripping it off.
Just rip it off.
So the hoop earrings and those kinds of things. So that's a traumatic issue. Insurance definitely covers that, but sometimes insurance covers other reasons for that as well, and it's something that we can definitely fix.
Ravi, it's been a pleasure talking to you. Let's give out your contact information, and this is so fascinating. I think we can just go ahead and do another couple hours on this particular topic.
So Dr. Ravi Somayazula, Body by Ravi.
Yeah.
My office number is 281-242-1061. The address is 3531 Town Center Boulevard South, Suite 102 in Sugar Land, Texas. And the website is www.bodybyravi.com. And again, our website will be up and running in about a month or so.
Okay, Ravi, it's been a pleasure talking to you.
Much.
And thank you for being on All India Radio Houston. Ladies and gentlemen, we are going to